So we were the first to show that a woman with cancer, this includes women with historical cancer and women with current cancer, they both have increased risk of peripartum cardiomyopathy compared to women without cancer. I'm Pengse Wu. I'm a clinical academic. I work in University of Kiel at the United Kingdom. I work as an academic obstetrician, so delivering babies, but I also do research in the university, specifically looking at cardiovascular outcomes in pregnancy. So I would like to talk about the study which I've been involved in, which is called In-Hospital Complications in Pregnant Women with Current or Historical Cancer Diagnosis. This has been published online already, but is due to be published in the November edition of the journal. So basically, we looked at 43 million women who delivered babies in the US over a 10-year period between 2004 and 2014. And out of all those deliveries, we looked specifically at outcomes of those with historical cancer, or with current cancer, or with no cancer, and just compared the different cardiovascular outcomes and their pregnancy outcomes. We discovered that the top 3 most common cancer diagnoses was hematological cancer, thyroid cancer, and cervical cancer. But the overall outcome that was most common in all these cancers is preterm birth. So this coincides with the previous pregnancy. But we were first to look at specifically in terms of cardiovascular complications in this group of women. And we showed that women with cancer have an increased risk of peripartum cardiomyopathy compared to women without cancer. In terms of the specific top 5 diagnoses of cancer, so we found that there's hematological cancer. It was the most common current cancer, and it had the most comorbid woman and the highest odds for mortality. And second commonest was thyroid cancer, and it was the most common type of historical cancer diagnosis. And then following that, it was cervical cancer, and that was associated with the highest odds for acute kidney injury. Then we have breast cancer, which was associated with the highest odds of preterm birth, and skin cancer, which had the highest odds for stroke out of all 5. So what does this mean? I think that it's really important for women with previous cancer diagnosis or current cancer diagnosis to be aware of the implications of their pregnancy, because they are at higher risk of obstetric complications, but also cardiovascular complications at the time of birth. So it's important for them to have appropriate counseling, and then also for the multidisciplinary team to be involved so that they can look after this very high risk group of women and make sure that the risk for these complications are reduced. I would like to invite you to read the paper, which has got more information on the specific complications and the different comorbidities of this group of women. And also we look at the temporal trends between the 2004 and 2014 and see how the characteristics have changed. So thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.